What's going on, ladies and gentlemen, maybe? It's Coach Z here from Max Impact Fitness, and I'm here with Dr. Nick Moore.
Hi, everyone.
Handshake, buddy.
Nice to be here. Thanks for having me.
From Restore Life Chiropractic. And today we're going to be talking about spine health as it relates to health, fitness, and wellness, and even weight loss. It all ties together. Sometimes we try to separate your training from your spine health and all that, and sometimes you're trying to separate it from your diet, but really it all ties together. We want to be one fit, wholesome package, right? So with that being said, I'm going to give you guys a little bit of background about Nick and how I met Nick. There was a time where I was having some shoulder issues, and you know, with the lifting and some of the stuff I do, it's nothing new. But this time it didn't go away. Even with all the stuff I was trying to do, stretching it, doing this and that, nothing had changed. And it had been probably over a month and a half before I was like, okay, I need to take another step in this, because my shoulder was still hurting. So I couldn't even lift like 5 pounds over my head. So talked to one of my clients here at Bootcamp, and she said, you got to go talk to Dr. Nick Moore over at Restore Life Chiropractic. So that's exactly what I did on her recommendation. Went over. First thing he did before he started doing any kind of adjustments or anything like that is we did a full evaluation.
Absolutely.
And like 100%, that's what kind of sold me on the process. He wasn't like, all right, just lay down in this chair. Hold on, let me get it focused. Lay down in this chair. Let me just start cracking you and doing this and that. The first thing he did was, first appointment was a straight up evaluation, and kind of showed me what we needed to do, got us a game plan, and then from there we went to work. And to make a long story short, probably after about 2 to 3 months of adjustments, man, I'm back to 100%. Shoulder's good. I'm back to lifting my, 100 pounds over, shoulder press. Sometimes, but we ain't gonna brag today. And that's the story. And that's why I decided to bring Dr. Nick in, because when you are, training and trying to get in the best shape of your life, spine health is important. And Nick's going to talk more about why that's important, and that's the topic of the conversation: spine health as it relates to health, fitness, and fat loss. So, Dr. Nick, I'm going to let you take it over from here.
All right, thanks. Well, just a quick summary of myself and our office. So, Dr. Nick Moore with Restore Life Chiropractic. We are located over in Zionsville. March 1st, we're actually celebrating our 3rd year in practice.
Oh, congratulations.
Yeah, thank
Congratulations.
you. We're excited.
Okay.
We didn't know anyone here, so it was scary and terrifying, but we've loved it, and we've grown great as a practice, so we appreciate all the community support.
And I'm going to stop you real quick.
Yeah.
When I posted this thing and asked for questions, because we're going to do Q&A after he kind of talks about spine health and all that, but I posted a Q&A and I was like, hey guys, give me some questions as, what do you want to ask Dr. Nick? And I got like 2 questions, and the rest of it was just like, hey, Dr. Nick is great. Like, he's the man, blah, blah, blah. So like, he's the man. I'm telling you from my own experience, but my clients rave about you guys.
Thank you.
You
What we pride ourselves on is putting clients and patients first. I'm here for everyone's health. Zach, you kind of talked about your story. As you said, we want to analyze. I want to understand what's going on with that person, regardless if they're having back pain, shoulder pain. We see a number of different symptoms that are coming into the office. Each person's an individual, and we have to understand that first. So we want to do our full examination, full analysis to understand where you are and where you want to go, because the where you want to go is also the really big important part, right? Because in your case, Zach, if you've got this shoulder issue and you can't lift 5 pounds over your head, if you're fine with that and you don't care about improving, how can I really start to all kind of take ownership as well and help you out and improve? You have to be part of this equation too, and that's kind of where your business comes into play, and we're going to talk about how exercising helps spine health, because that's the big takeaway. We only have one spine, and I've never heard of a full spine replacement. So
I don't think you want to do that one.
I don't suggest that. So let's make sure we're taking care of the one we have. So why is spine health so important? Well, first let's understand kind of the players in it. We have a couple different aspects of the spine. We have the vertebra; those are the bones. And then we have what are called discs, and those reside in between each vertebra, okay? What those do is form a joint, and in between and out of that joint comes our nerve roots. Okay, so in our spine is protected our spinal column. From there, our spinal nerve roots exit at those joints. That complex is what is so crucial that we need to protect for our overall health.
Yeah.
Okay. Now, what is important and how do we protect those joints is we also have curvatures in our spine. Okay. So looking from the side, if I was to turn from the side, we have 3 different curvatures: one in our neck, one in our mid back, and one in our lower back. And those curves also help with spacing at those joints. It helps take off some of the pressure from those discs. And okay, now you're going to hear me mention the vertebral discs a number of times because they're so important. Okay, and
what are the vertebral discs? Because I'm gonna tell you right now, half the people watching are like, "What is a vertebral disc?"
Okay, it's kind of like a spongy kind of tissue that keeps the joints from compressing on top, or the bones from compressing on one another.
Got it. So kind of like a cartilage, like in a knee or something like that.
Yes, absolutely, or even like a shock absorber.
Yeah.
Right. Okay, so kind of like the bottom of your shoe where it prevents your foot from hitting the ground. Okay, it allows the body to have that shock absorption so that as you're doing all of your stressful things, like even something like walking, it's going to maintain its integrity. Okay, how vertebral discs maintain over the long term is motion. Okay,
so that's where this comes in.
Yeah, that's exactly how we're going to tie this in, because they have one artery in, one vein out, so really bad arterial supply for such an important part of our anatomy. So how do we keep them happy? Is we keep them happy with motion, and most specifically, proper motion.
Gotcha.
Okay. So let's talk about stress, because stress is going to really hit us on a constant basis, and there are a few different types of stress: physical, chemical, and mental. Today we'll focus on some physical stress, right?
Okay.
So,
of course, just a second. So one of the things you told me when you did my evaluation, you were talking about treating the symptom versus, and maybe you're probably gonna get to that, treating the symptom versus treating, where you needed to go in your particular spine. So we can even use my case as an example, but absolutely. That was one of the things
if you're okay with that.
I'm totally cool with that. That was one of the things that stuck with me, is I was so focused on, trying to get my shoulder, trying to stretch it, ibuprofen, ice in the particular area, which was treating the symptom. And long story short, it was never going to get better by going and treating the symptom. Correct. It wasn't until we corrected what I needed in the spine that everything started to change and improvement started to be made. So I'm going to let you come back.
All right, yeah. So everyone heard it. He gave me permission to talk about his case. So shoulder's a great example, okay? So in that shoulder joint, and this is what happens to a lot of people, we get an injury or we have something not healing the way it's supposed to. Right now, if you're picking up something and you feel that quick injury, maybe there's a tear. But if this is a long-standing thing and you've kind of noticed this going on for about a month, or when it should have healed.
And that's when I came to see, because I was just like, this isn't normal. And
it should have healed.
And there was no tear. There was no, there was a moment where it's like, oh, pop, okay, wait a minute,
It was just kind of long-standing, and that's where the question has to be, why? Okay? Yeah. And so what we know from the spine, as I said, spinal nerve roots, okay, these nerves come out and form a big bundle of nerves from here. From here, they go and they control everything down this part of the arm. Now, what we had found on Zach was, yes, he did have some joint adhesion, so we had to work with the shoulder joint itself as well, but he also had some pressure on the nerve that was innervating or controlling this part of this big bundle of nerves. At that point, until we actually were able to get that pressure off that nerve root, is this getting the signals it's supposed to from the brain? The answer is no. No. And that's what we had to first start off correcting, right? We were looking to take that pressure off that nerve. Once we did, now we get better function and better communication from the brain, which is healing at that joint. Now we can start to work point specific at that joint, get that joint moving better, and that's how we get back to health.
And that's when the healing started.
That's how we get back to healing.
Absolutely. So let's talk about someone who might be dealing with, some typical ones, obviously back, shoulder, neck. There was another one I can't remember right now, but even like in the hips.
Sure.
What would be your first course of action if someone came to you and like, man, I'm having back pain or, shoulder or neck pain, anything like that?
Yeah. I'll actually talk about a recent case that came in. She, for a decade plus, has sworn she has SI pain. Okay. And so SI is the sacroiliac joint. That's part of the pelvis right in the back, kind of that lower back. That's what she always thought. That's where her head was as far as the diagnosis. And that's fine, but I'm going to do my examination first.
Absolutely.
Okay?
Yep.
And so we did the examination, and she had some scoliosis that she didn't know about. Yeah, some scoliosis in the third lumbar. And specifically at that third lumbar, there was a ton of pressure on that nerve.
Yeah.
And I think I've seen her a handful of times. We've started to take that pressure off that nerve.
Yeah.
And she kind of did that, kind of dumbfounded look going, you haven't touched my SI.
Right.
Why has the SI started to improve by working with the third lumbar? And it's, as you said, I'm looking to work with the cause. And when we find that analysis, now somebody else might come in with SI pain or hip pain. And it might be their SI joint, or it might be their hips. But first and foremost, what always has to be done is the examination and analysis. Because
so that's where we start.
We need a good working diagnosis. Because once we can find the cause, once we start getting the body back to that healing state, that's where we can actually start to make progression.
Yeah.
Symptoms are kind of what I call check engine lights, right?
Right.
They come in on your car, but you don't know what's wrong.
Right.
And what's the last thing you want to do? Pull the fuse to the check engine light, right?
Like that's gonna fix anything.
It's gonna shut the check engine light off. But your engine still might blow.
Right.
And that's not what we want.
And that's like just taking ibuprofen or whatever to just kind of get rid of the symptom. But obviously, it's gonna come back.
That's correct. I get some days where you're just trying to survive and get through the day, and you need that quick Band-Aid to kind of get through that thing.
Yeah.
I get it. I do. But if you want to get back to a healing state, you got to look to the cause.
So what if someone, I've heard this one, I think I slept on my neck, I think I slept wrong. So my neck is hurting or shoulder or something like that.
Yep.
I'm sure you probably hear that one all the time.
At least twice a day.
Okay, at least twice a day. So what do you say to that?
Yeah. Sleeping wrong, the first question I always have to ask is, was it on the same bed? Was it with the same pillow? Okay, if all the factors of your daily life were the exact same when you slept, do we really think it was sleeping wrong?
Correct, right.
I don't.
Right.
I don't. Okay.
I agree.
I agree. So what happens in that incident? Well, as I said, our body's always inundated with different types of stress. So think about it. Today, you're going to be bombarded with physical stress. Right now, we're sitting down. Okay, that is a physical stress to us. Yeah.
I'm sitting straight up.
Thank you. I appreciate that.
All right.
So we're bombarded with these stresses throughout the day. Okay, physical, chemical, mental, and our body's constantly trying to heal from them. Well, to the fact that they can't fully adapt, i.e., if we have some pressure on the spinal nerve roots, okay, and then we go to bed, and what's sleep time? That's healing time. That's what our bodies are supposed to do.
Yeah.
So we go to bed, quote unquote, fine. Our body tries to heal through that process throughout the night, and it can't. And so we wake up, and all of a sudden we feel something, and we go off that field going, did something, I went to bed fine.
Right.
I woke up not fine, so something must have happened while I slept. And it's the fact that the body then actually healed the way it was supposed to from all the stress prior. And it can be something chemical, it can be something mental. We all know how mental stress can really impact us, right?
Absolutely.
Even from that physical stance of what happens with mental stress, we start to wear our shoulders up at our necks, and we get really tense and all those different things. So the sleeping on the neck thing, that's why I kind of chuckle, because I hear it on a daily basis. It's, if the body's not adapting, if the body's not healing the right way, in your healing time of need, sleep, your body's not doing what it's supposed to.
Okay, and then that goes back to something. There may be something in that spine. Let's get an evaluation. Got it. All right. So, and the reason I brought you in was actually one of our clients. This was her question. She said, ladies, I'm struggling with some low back pain and some back spasms. They're going on now for a month, and any stretching tips or anything like that you guys can offer, but. She couldn't really pinpoint what was aggravating it. It was just, today or that day she was doing some sled pushes. It was killing her, but she's done sled pushes in the past. no problem,
Yep.
right? So there was never any point where it was like, ooh, you know, bam, like, oh, okay, I know it happened then, you know. So, and then she was asking for tips. So I brought the man in to give us a tip. So what tips would you give her?
Yeah, you know, when we see something like that where there's no specific injury, right? So often we're looking for that one incident that caused that discomfort, and a lot of the times, again, what happens is the fact that it's the culmination of a bunch. Okay? I love analogies. So let's think about a dam, right? That's being crashed into by wave after wave after wave. When that last wave breaks that dam, was it the last wave's fault, or was it all of them building up until that point?
Yeah.
And so, you know, and you know, I'm certainly not diagnosing this person, but in this incident, could there have been something underlying for a long period of time?
Yeah, and after talking to her, it was. But keep going.
Sure.
Yeah.
And did it just become too much? And at that point, now the body can no longer heal the way it's supposed to, right? At that point, the body is now putting pressure on just that right nerve, okay? Because not all of our nerves carry pain. And that's a big misnomer. Like, anytime we injure ourselves, we think, oh, well, we better track pain. Pain's not always the indicative factor, because luckily not all of our nerves carry those pain signals, right?
True,
Think about
true.
it. If 100% of our nerves carried pain,
we would be
miserable. We wouldn't
all
be
the
smiling
time
as much right now, right? So in that instance, there's probably been something underlying for a long period of time.
Yeah.
It just got aggravated to the point where now she's really starting to feel it.
Yeah.
And now it becomes that problem. If the fact that the body hasn't even healed it, which it certainly hasn't, because most likely there's that underlying issue, it's never going to get back.
Right.
You might feel better for a little bit, but until that actually gets resolved, we won't get back to that healing line.
And let's talk about what you can do, like, in your workout. You know, one thing you can do is always, no matter what kind of lifts you're doing, is keep your core tight. Just like you were telling me, when you're sitting straight up in the chair, core is tight.
Yep.
So you're doing a bent over row, you're doing a deadlift, you're doing squats. Core is tight, almost like you're planking on the floor where you want your body completely straight. So no matter if you're doing curls or whatever you're doing, you want to keep your core tight. Make sure you're focusing on your breathing and focus on that mind-muscle connection, right? What am I trying to engage in this particular exercise? Even when you're doing deadlifts, and you can speak to this because I know you do a lot of I've seen you doing work in the gym.
Talking about.
But having your core tight, even though a deadlift, you know, per se isn't like doing crunches, it's not a you know, something to get your abs tight, if you will. All of your whole system is engaged in that movement, and what's the base of it? It's your core, right? So make sure you have that engaged while you're doing exercise, no matter what you're doing. And then obviously you want to make sure you have, you know, good form while you're doing it, right? So that you're putting the stresses in the areas where you want the stresses to actually be, versus doing it wrong and then you have, you know, 90% of the stress in your lower back when it's supposed to be distributed throughout your entire body.
Yep.
So Marsha actually brought up a good point. She's mentioning she's a poster child of long-term back injury. She was like carrying a child on one side of your body for a decade. I guess that could, you know, equal some uneven stress.
That's right. Asymmetrical posture at that point. So that's improper posture for a long period of time, and I know that's sometimes tough for moms to hear. I won't pick on the moms versus the dads, but
well, you know, hey, the majority of people watching this are women, so
okay,
let's just call it what it is. We can be real about it.
Yeah, you know, a lot of women hip hold, so I am gonna pick on the women here a little bit.
That's okay. That's okay. They need to hear it.
They do the hip hold. They do this, and think about if I sat like this for a long period of time. First of all, you're gonna ask, what is he doing right now? Right? Because this
I was going to ask, but you know,
so abnormal. But that's exactly it. So we have to find different ways, and you know, we're starting to finally understand biomechanics here a little bit better. As far as, all right, just because it was societal norm to hold, I'll pick on the baby carriers from, you know, the car seats. We used to hold it like a basket, right? Where we held it from the bottom. And what happens? You're getting pulled down like this because your center of mass now is shifted way, way, way down close to the ground, because your baby weighs X number of pounds and those carriers weigh 10 plus pounds.
Already,
so now you're kind of dragging like this. So then you pick up like this and you start to hold this improper posture.
Mm-hmm.
Do it long enough and it's going to start to adhere. And when you put that improper posture and stress, so long, the body starts to adapt to it, and it's the last thing that we want. So that's where there's been improvements, and we've started to understand, listen, there's a different way you can kind of hold that, so you can pull it up closer towards your center of gravity,
keeping that core tight.
And that's exactly it, keeping the core tight, so that's at that center of gravity, and now you're holding it here, and this is the way that you can hold it. Holding a baby for 10 plus years on your hip is the same thing, unfortunately, and it's just getting to understand a little bit more of how it's going to impact long term. Because, as you said, if you're not holding that core tight when you're doing a deadlift, we understand that, because that's a huge stress in a quick way, right?
Absolutely.
But what about all of our daily stuff?
Yeah.
Like sitting, right? So if we're sitting like this, we're holding this improper posture, we might not, quote unquote, feel this as quickly as if we do something with improper posture, like doing a deadlift.
Yeah, especially with more weight than you should be doing.
That absolutely. But doing that improper posture slowly, consistently, over time, is that also going to impact us? And the answer is yes. So, long story short, Marsha, we do want to make sure that we're holding the child properly.
Yeah.
There are different ways as far as chest, and not always ideal. And if we have to have some bad posture because Junior's crying for a little bit for a period of time, that's fine. But doing it on a constant, consistent basis will have that long-term effect.
And keep your core tight. Just had to throw that in. All right, so Megan Maple had a question. During V-ups, bicycles, leg raises, basically anything where you're laying down with your feet extended away from your body.
Okay.
She occasionally has lower back and a weird lower back makes weird rubbing noise.
Okay. Yeah, so a lot of people think about, especially when they're talking to chiropractors, they think about the noise, right? And so if we're doing something and we hear a lot of clicking, a lot of popping, or kind of that crunching, rubbing, grinding sound, that's joints moving, okay? And there's good ways for joints to move and bad ways for joints to move. And if we're just going through like a general motion, like you're doing the V-ups or the bicycles, and you're hearing click, 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 pop, 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 that tells us a lot of instability, okay? Because what that tells us is the joints aren't working the way that they're supposed to, and we might have some hyper mobility at those areas. Now, the good and the bad. A chiropractor can't really help directly the hypermobile segment, okay? Because that tells us that the ligaments have kind of loosened a little bit and the joints kind of moving around too much.
Yeah.
The good, however, is what the hypermobile segment tends to be is a compensation for something else. So think about it. If you're hearing kind of clicking and popping on one side of your hip or your pelvis, what it tends to be is a compensation for the other side. Or if you hear your knee clicking and popping a lot, it tends to be a compensation for maybe some ankle adhesion or some pelvic adhesion. So i.e. those joints aren't moving enough, so those other joints have to move so much to compensate for total mechanical change. So a lot of times that's what.
And I've seen that where people have like one side that's taller than the other, so then you have all that compensation happening, and then like you said, those things can happen. One thing, just from a workout perspective, again, core tight, but when you're doing anything with your feet out away from you, I wish there's really no way to demonstrate this, so I'm going to make a separate video for it, but make sure when you do it, you have your feet out in front of you, but your shoulders are up, so your core is engaged. Because if you just have your feet out and you're laying completely back, that means your core is totally loose, and then there's going to be this hump that I could almost stick my hand through underneath your lower back, and that's where all the stress is. The stress is completely gone from your frontal core, from your abs and all that, and it's completely gone to your lower back. And when you're doing a leg raise, a V-up, or anything like that, that is not what you want. We're doing it to build some abs, to help you flatten your stomach and all that, not put all the stress in your lower back. So really your core position when you are engaging in those movements needs to be right from the jump. So I'm going to make a separate video where I can actually lay down and you can see what we're doing to help you out with that. But that's a good question. Let's see. What about popping? Okay, so the popping and hip flexors would kind of go to your...
The popping and hip flexors, same kind of premise, where there's probably some instability either in the hip sockets or the pelvis or some joint. Again, it's hard to fully diagnose that without checking, but there'd be some type of unstable joint where it's just moving around a little bit too much. And we want to, one, first and foremost, make sure that the joints that need to move correctly are, and then two, all right, then that's where we have conversations with someone like yourself, Zach, and say, hey, we're working so-and-so, just so you know, they need to be doing a little bit more hip strengthening or more hip mobility, whether it's unstable or needs stability.
Or to balance it out.
Exactly, whether it's hyper or hypomobile, depending on. Yep.
Got you. Let's see. Jody asks, I've been experiencing lower back pain for several weeks, and certain exercises seem to aggravate it. At what point do I need to go to a doctor, or even a chiropractor, or maybe even a PT?
Yeah, really good question. It's chiropractic by true definition is prevention, right? We want to make sure we keep people well, but a lot of the times people have symptoms like that. So, if something's not healing over a long period of time, it's time to get it checked out.
Yeah.
Okay. Whether it's by a chiropractor, chiropractors are going to look at it differently than a traditional MD, and a traditional MD and chiropractor are going to look at it differently than a physical therapist. The physical therapist is first and foremost going to be looking a lot of the musculature and the surrounding areas and how to stabilize it. And there are a number of good ones that I use to help in that basis. With kind of the MD route, we just want to certainly make sure that there's no tears, because tears, that's outside of my wheelhouse.
Right. So if you have a tear, like you're doing something and it's like boom, tear, Nick's probably not the first person that you're going to want to go see.
If you saw me at that point and we determine it's a tear, it's me getting on the phone and making a quick ortho call.
Yeah.
Because I don't cut. So,
yeah. Right.
So and that's the help that we need at that point.
But speaking of cutting, in my opinion, and I'm happy to hear you chime in on this.
Yeah.
Like anything when it comes to cutting, surgery, anything, that should be the absolute last resort. You shouldn't be going to a place thinking surgery right out the gate. You should be thinking, let me get an evaluation. Let me see what the true issue, what the root cause of this is. Because I could have went into it thinking like, oh man, I just got to go get shoulder surgery. I must have tore something. But I'm happy I did not go down that route. And, it's a lot cheaper. I'm going to tell you this. It's a lot cheaper to go get some adjustments for, 2-3 months and get a plan that way than it is to go, to go get cut and do some surgery.
Yeah, we should always approach any form of health, right, as far as least invasive to most, as far as necessary. And that's the importance of doing things like your program, right? Because you're moving people towards health in a non-invasive way so that they can avoid all those other things. And myself as well. Why I want people under chiropractic care is because we're keeping their spines well and keeping their bodies healthy. Let's try and prevent them from needing the more invasive. Now, when somebody does need something more invasive,
you gotta do what you gotta do.
Then it has to be done, and that's fine. But first and foremost, we should look to least invasive. Can we work this way without any type of surgery, without any type of medication? And then if we need to, fine, we address it as needed.
Yeah. And another thing I'm gonna mention about your service is, at no point did we, you have to write me out a prescription and say, oh, go do this, to make you feel better. Yep. I mean, it was just natural, the adjustments and all that. I mean, it's completely natural, no prescriptions needed. And man, I have a real appreciation for that, because so many people, the first thing they do is let's go get some pain meds, let's go get some Vicodin or whatever it is. And, that should not always be the first place that we go. But I think society has kind of drilled that into us, that the pharmacy is the first place you need to go.
Very, very much, because we're a very fast moving society, right? We're quick and so
instant.
Absolutely.
Have the microwave solution.
It has to happen.
I want to lose 20 pounds today. Come on, baby.
I know.
20 pounds right now.
What's the right diet? I need to look like this. Yeah. And that's it, unfortunately, right? Yeah. Because our bodies are supposed to be healing, are supposed to always be moving towards health. Okay? And that's what chiropractic wants the body to do. And it's a process, right? You're 100% correct. I didn't write a prescription. I can't, nor do I ever want to. I'll let other people do that. Yeah. And the point is, I didn't send you home with an orange bottle, right? But
no supplements, no nothing.
But what was the commitment I needed out of you?
No, you needed me to do some things.
I needed you to show up.
You need me to show up, but
right?
you also asked me to do some stretches and things outside of there, and
because it's a partnership.
Is it 100%?
Health is a partnership, and it does take a lot of concerted effort. But that's how we get our bodies actually to that healthy, healing state, and that's what we should all want for each other and certainly ourselves. And that's it. You know, it's not always going to happen overnight. Like what I try to get patients to understand is the adjustment isn't the quick solution. The adjustment is the start of the process, right? So when again, to use you, when we started working on 2 different spots to start in your spine, that's the start of the healing process. It wasn't the solution. It wasn't like you came back the next day after the first adjustment. It wasn't. I'm healed. No, that's not what the body's going to do.
Well, for me, it was, after those first couple of adjustments, I saw improvement.
Right.
Yeah. So it was like, in fitness, it's like seeing that first, look, I got 20 pounds I want to lose, but after my first couple weeks, I see the first 2 to 3, 4 pounds come off, right? And I didn't get 20 overnight, but in fitness, this is how we get to that permanent solution, right? Rather than that quick fix where the weight comes right back on. So we're going to start wrapping this thing up. It's been a good conversation, so it went a little bit longer. Yeah. Hey, if you guys are enjoying this or got some great information out of this, make sure to give this video a thumbs up, a comment, or whatever. We appreciate it because, we'll do more stuff like this more often with, experts in the field like Dr. Nick Moore here. And so let's kind of transition real quick. Yeah. When it comes to going to see a chiropractor, one of the big fears people have is you're gonna tear them up, you're gonna hurt them bad.
Sure.
So I'm gonna tell you from my own experience. The adjustments. I never walked out of there, crying or anything like that. Even if I did, I probably wouldn't admit it here. But but that never happened. But what do you have to say to that? Yeah, I think that's one of the things that is preventing people from taking that next step sometimes.
Nope, I appreciate that question because that's something I get a lot. And when it comes down to it, so our office is a full family office. I see in our office we've seen as young as 5 days old to 87 plus with osteoporosis. Okay, and also strapping men like that. So the point is, the adjustments are to individuals for what they need, okay? And not every single person needs the same amount of force or the same type of correction, and it's specific for that individual. The force is always the right amount just to make that correction.
Yeah.
No more, okay? And it's not even a lot of it. As I said, I've worked with a number of individuals with osteoporosis, and those are frail bones, and there's never been any issues because it's the right for that person. The adjustments are gentle. They are done via hand so that I can determine, all right, what is this person's joint allowing me to do? And then we make that slight correction. And that slight correction, it feels a little awkward because, well, it's an adjustment, right? And you're not getting that on a daily basis by strangers walking by in the street.
And so does a 2-minute plank. But
exactly. But it's for that benefit. So
okay. So as we wrap this thing up, if people want to get in contact with you guys over at Restore Life Chiropractic, and after this discussion, like, you know what, I've been feeling some neck pain, some back pain or something, and I can't really pinpoint what exactly. There was a point where it tore or something like that.
Yep.
And this pain has been lingering. And I think that's kind of the gist of this conversation.
Yep. The not healing.
Right. Things are not healing. How could they come see you and kind of get the process started?
Yep. Best way to get in touch with us is give us a phone call. So 317-344-8400. Or you can check out our website, restorelifechiropractic.com. My lovely wife, Amber, is the office manager, and she will certainly happy to answer any questions. You can certainly shoot me an email at restorelifechiropractic@gmail.com. I'm always happy to answer questions. I love talking chiropractic. And so any questions any of your viewers have, certainly I'm happy to ascertain and chat with.
And we're happy to, Nick isn't paying me to do this. I went there and I was like, hey, our clients could really use, and benefit from what you're doing.
Yep.
Because I know where I was at several months ago, and I know where I'm at now. So if you guys have any questions or, or want to talk more about some of the things that we talked about, Dr. Nick is the expert. Go see him at Restore Life Chiropractic. He gave you the phone number. Google it. And yeah, we go from there. Appreciate it, Nick.
Zach, pleasure.
Hey, no doubt. So hey, if you guys have any questions, comment below. I'll shoot over to Nick. If it's, spine health related, I'll shoot it over to him. If it's fitness related, I'll answer it. All right? Talk to you guys soon. Thanks.